Listen to The Barry Morgan Show. Live weekdays noon to 3 on CJAD 800 and CJAD.com.
My guest in studio right now wants to tell you about what she says is breakthrough autism therapy, which is, which sounds really, really good. And first of all, before we go anywhere else, her name is Sazini Nzula. She's a PhD doctor, or Sazini, if that's okay.
That's okay.
Nice to meet you.
Nice to meet you too. Thank you for having me.
You're very, very welcome. I think this is, very important, and I think a lot of parents who are, look, it's no secret a lot of parents are struggling emotionally, financially as well, Sazini, with when their child, whether they're not sure if their child has autism, once they get the diagnosis, well then just so many issues crop up.
Yes, they are. And as you know, autism is a spectrum. Children have, it varies how they are affected, and parents really struggle, especially in Montreal, for therapies, because the waiting list for government services is more than 2 years. For me, it was more than 2 years. And that's why I like this, because it's something that parents can do at home on their own, and there's studies that show that it will benefit their children.
So, and you have 2 children?
I have 2 children with autism.
And that's what got you involved in this?
Yes,
in this therapy. So let's cut right to the quick then. What is the name of the therapy and how does it work?
It's Qigong sensory treatment, and it's a Qigong massage. And
it's a massage.
It's a massage.
Okay.
It's a massage that parents do, but it's really different from going to the spa. It's padding movements, different movements from going to the spa. So since the last DSM-5, which is the book that's used to diagnose autism, amongst other things, in the latest version, which came out about 2 years ago, they have included sensory processing difficulties as part of the diagnosis of autism. So how Qigong massage works is by normalizing the sensory problems that children with autism have.
Okay, and it works.
It works. It's been, I think there are over 12 studies now. The latest one came out in March, and that one was a longitudinal study. So the study went on for 2 years, and the previous studies had been for five months. And it decreases parental stress by 44%, decreases the signs of autism by 33%.
Is that right?
After 5 months.
After 5 months.
Yes.
So can you give me an example, just practically speaking, how the massage actually works and how it differs from, going to the spa?
Very different. The massage takes 15 minutes, so parents are trained, and they do the massage every day for 5 months. And it's padding movements and the child is dressed. So you do padding movements, and it's a series of 12 movements that the parents are trained how to do. And children enjoy it, they ask for it, and after a while they get used to it. And why this is breakthrough is because it treats all the symptoms of autism.
How does a massage actually change what's going on in somebody's head?
Because you're retraining the nervous system in how it interprets the sense of touch. The sense of touch, once that's opened up, then everything else opens. And part of the things that the massage targets are language and socializing. The actual mechanism has not been worked out in the studies. The studies didn't look at exactly how does it work. The studies looked at, does this work or does it not work, and in what way does it work?
So how much of a difference has it made for your kids? For
my kids, it made a big difference. In terms of sensory problems, my son didn't wear socks. It was a huge deal. Eating was a big problem for him. And he was a child who really didn't like to be hugged. And so he started wearing socks one day, and I would try them. And it seems something small, but socks were just an indicator of all the other areas where he had problems with touch. It does seem small, but exactly as you just said, it's a great indicator of how kids with autism actually have issues with like tactile issues and so forth. Tactile issues. Food, for my son, food was an issue. Until he was 3 years old, I would have to mush his food because eating rice was a problem for him. He would throw up. So his eating is better. Now I actually have to hide food from a child who didn't eat very much.
No kidding. Wow. Speaking with Dr. Sizini Nzula, who is now a therapist. You've become a therapist yourself, right, in this Qigong massage therapy?
Yes, I did. After doing the massage on my son, I went to Portland, Oregon, and I did the training with Dr. Silva because I saw a need in Montreal, because really parents don't even need a therapist. You can buy the book. The book comes with a DVD. It comes with a cheat sheet of all the movements, and you can form a group and teach yourselves in your group how to do the massage. And here in Montreal, for me, I saw it as a need for parents who are sitting there waiting for services.
Absolutely. And so how long did it take you to train?
The training takes 6 months.
6 months, okay.
Yes.
And then, you talk about it being low cost, right?
It is low cost because it can cost as low as $35 for the book on Amazon or Indigo online.
People could learn the how to do this just simply with the book without having to go to a class?
Because the book comes with a DVD.
Okay.
It comes with a DVD, and it comes because Dr. Silva wrote it for parents to be able to use. And most people in the U.S. don't have access to a therapist, certainly not in Canada, because in Canada there are only 5 so far that I know of. There are 4 trained therapists, and then there's 1 parent trainer who doesn't actually work with children.
So how many therapists are there like you in Montreal?
2.
Just 2?
Yes.
Wow.
So for most people, they may not get access to a therapist, but they can still do this on their own.
Would it take the place of so-called traditional therapy?
No, because I really don't think there is a one therapy that's going to solve all of your child's issues. I don't see it as, not even for my children.
Somebody texted Dr. Nzula, what specifically makes Qigong better than all other forms of massage for this particular application?
For me, what makes it better is because it empowers parents. When your child is first diagnosed, you don't know anything about autism and you are relying on other people and you feel disempowered. You feel like you have to wait for the experts.
And you're lost. You feel
You're
lost.
lost.
Yeah.
But with Qigong, you as a parent, you touch your child and you get to connect with your child, and you have the power in your hands to solve all of your child's problems. And I feel that's what's important about Qigong.
Is this for kids on any part of the spectrum?
Yes. The studies show that
most extreme to the most mild?
Most extreme to the mild children.
I may have asked you, but how quickly did you see results with your kids?
The studies say 5 months. So anytime, but after 2 weeks, you could see results. After it depends.
Depends
really.
on the kid.
I don't want to predict and say, okay, after so much time, you're going to see this. But in terms of the studies, it was 5 months, and they saw these amazing results.
And it really improves all aspects, language too?
Language, behavior, because what it does is it opens up children to socializing. And once you can socialize, and once you decrease all those sensory problems, whether it's hearing, whether it's people looking at you or the sound, then you are more receptive to listening to them, looking at their face and communicating.
But there are some kids who have verbal issues, and from my experiences with autism and my family, the doctors make it quite clear that some kids they never speak.
That is true. 33% of children on the autism spectrum, I saw a study the other day, 33% do not have verbal language.
Right.
And
so
I cannot promise that.
No, I understand. Right.
That's just what it is. The numbers are 33% of children with autism never develop verbal communication.
Okay, so you're not trying to sell somebody necessarily on something that...
No, this is no magic bullet. It works, and for me, I see it as part of other things. But for those 33%, they just never do speak. That's just how it is.
The fact of the matter is that a lot of people have to go the private route for maybe a year, maybe 2 years, and some people simply cannot afford to do that.
People cannot afford it, and they cannot the waiting for 2 years for your local readaptation center, that's really very hard for many parents.
I'm just going to give out your website now. It's EdenQigongMassage.com. I'm going to spell that for you. EdenQIGONG massage.com, and we'll have that on my show page as well, okay, because the audio will be there pretty shortly. So if you're looking to reach Dr. Nzula, by all means, thank you very much for your time today.
News Talk Radio, CJAD 800, CJAD.com.